Okay, I'm running here.
So considerations for the shoulder girdle are to remember to place it within the hierarchy and recognize that certain primaries related to that area are often priorities in terms of the sequence of treatments. So consider local long bone injuries to the upper extremity as being a conductive issue with the shoulder girdle. And then also looking at neurological issues, which could be cranial, dental, upper cervical, cervical thoracic, or upper thoracic, including the rib cage. Those are higher order hierarchical considerations when it comes to the shoulder. So local injuries to the shoulder, of course we talked about the idea of the scapula, the clavicle being affected, expansion of the humeral head. All of those considerations need to be addressed. In addition to that, we want to consider the instability of the shoulder, which we talked about in a previous video, which is testing one of the ways to do that is to test the tone of the supraspinatus, and then make sure that you've identified the connections to that, often due to primaries in the upper thoracic, cervical, cranial, or dental areas. So that can be easily demonstrated to your patient so they understand the mechanism of their injury and why they have recurring issues. So the structural and the functional components are addressed. So once we move into the area of the local injuries in the shoulder girdle, we'll start with the scapula. We've already addressed the humeral components to some extent. All right, in the body of the scapula, we're going to be testing the x-axis, and we're going to be testing the y-axis through the medial border, and then the diagonal axis through the lateral border, like so. And positioning for treatment, placing the scanner over the body, and making sure the patient is positioned comfortably for you to be able to access them. Adjust the height of your table or your body position and leg position so that you can maintain a comfortable posture during treatment. Coming in this case, for the x-axis through the lateral aspect of the humeral head and the medial border of the scapula, as we demonstrated earlier in the skeletal model, like so. And then for the medial border and portion of the y-axis here, checking to find the location of the inferior angle, containing that through the hypothenar eminence here, and then up on the spine of the scapula from above. Containment is superior and inferior. And then the lateral border, to test for that through this area, you're going to also use the inferior angle, but in this case you're going to go to the upper portion of the humerus and the acromion and contain medially and inferiorly towards the inferior angle, like so. So next we're going to move to the area in the supraspinous fossa, which is right in here. And for that we want to contact and test from the superior angle posteriorly towards the spine of the scapula along here. Right? Remembering that the upper ribs may be a factor here. They should have been dealt with to some extent. They're often injured as well. So check those and treat those accordingly. So for that, we're going to contain on the superior portion of the border of the scapula. That containment is inferior and posterior, and the scanner can be placed in the area. The contact on the posterior superior aspect of the spine of the scapula, that containment is anterior. So we're basically containing towards the center of the fossa, anywhere along here. That may extend forward. And that brings us to the acromion and the glenoid process. The acromion process can be treated just by locating the anterior and superior borders here and containing using contacts on the thenar eminences like so. Okay, smaller children or smaller individuals, you can use the thumb contact in some cases. And then once we've addressed the upper humerus as well, making sure that we've treated that properly, we're going to then look at the glenoid process, which is just below the spine of the scapula, approximately here, on the posterior contact, just medial to the humeral proximal head, and then checking anteriorly, as we demonstrated earlier, on the coracoid process, also just medial to the proximal humeral head, and containment is going to be on those two structures, just like so, using the thenar eminences or hypothenar eminences, whichever is more comfortable for you, making sure that your posture, of course, is balanced at all times. Okay, once we've accomplished that, we can then focus our attention on the clavicle. I'm going to have you just go on to your back, please. Good. And you want to bring your patient a little closer to you on the involved, towards the involved side. Let's say this is the side that's involved. You've checked the relative length. You can note the expansion of the size and the y-axis as well. So you want to locate your landmarks. First landmark here, just to the lateral side of the manubrium, upper portion of the manubrium and lateral, is the medial border of the clavicle. It's a fairly large structure. Relative to the lateral portion, which is just a very small expansion just above and medial to the acromion process, and you can just barely get a little bit of a contact here. And so our contacts with on these areas are going to be, with the lateral contact is going to be just taking hold of the acromion and the clavicle just here in this portion of the hand. You can just barely get hold of those two areas. You want to get them engaged together as one structure, okay? And that's going to just brace this area here. And then you have a larger containment point here on the medial side. Get that hand sort of oriented so the fingers are directed towards the posterior base of the neck. And then your scanner can be in that area just above it. Your other contact is going to be with the hypothenar eminence on the medial border, but then wrap the heel of the hand posteriorly and contain the entire anterior portion of the clavicle, like so. And your containment will look like that. So both fingers are directed posteriorly, right? Your containment is lateral and medial, okay? But your fingers are oriented so they're creating a little bit of a V-shaped structure like that, so you can complete that containment. And that's it for the shoulder girdle, step 1.